welcome to video F in our A to Z series. Today we're going to be looking at fewer misunderstandings in healthcare. What are some common misunderstandings? Well, health literature can be littered with medical jargon or overly technical terminology, as well as complex explanations that lead to a lack of understanding and misinterpretation by the audience. When details about health conditions and situations are neglected or omitted, this may lead to misconceptions about the repercussions of certain choices, including, for example, the urgency of addressing certain symptoms or the financial burden of certain courses of action, such as how insurance or out-of-pocket costs would play into the picture. Risks and benefits may not be fully understood, leading to uninformed decisions about next steps or treatment options, and leading to unrealistic expectations about the outcomes of a treatment or procedure. You also have varied cultural beliefs and practices, which can interfere with somebody's understanding of pretty much everything we've just mentioned. Now, what are some ways you can prevent misunderstandings? One way is to use plain language to make information accessible to your audience. You want to provide written as well as verbal instructions or an audio component whenever possible, including visual aids as deemed helpful, like diagrams, charts, or illustrations and videos to explain complex concepts and procedures. You can allocate a time and a place for discussion and invite feedback and questions. In some settings, you could utilize a professional interpreter for non-English speakers when possible, and be mindful of any cultural beliefs or practices which may influence that patient or that audience's interpretation or acceptance of medical information. You also want to ensure consistent messaging and information given across the board, making sure there's no conflicting advice in what you're providing. Now, what are some benefits you might see from all this? For one thing, you might see better health outcomes, as you see greater adherence to treatment plans, fewer medical errors by clarifying misunderstandings, and ultimately an effective emergency response on the patient's part because they understand the urgency of certain symptoms or developing conditions. You might see greater patient engagement because this greater understanding of the healthcare journey leads to lower stress for the patient as they have a means of communicating their concerns and having their questions answered. And additionally, any peer groups allow them to learn of others' experiences within a comfortable environment. You also lastly might see reduction in health disparities because of more equitable care, where clear and culturally sensitive communication is engaged in, and access to resources and support is provided and communicated to all patients regardless of their background. Our expert tip for this video on how to engage in cultural sensitivity, we invite you to check out a 2020 publication called Practicing Cultural Competence and Cultural Humility in the Care of Diverse Patients, which is linked in the description and can be found on PubMed with more details. Thank you so much for joining us today, and we hope to see you next time for video G, Greater Patient Engagement.